Broadcasting from the Cass Corridor in Detroit, this is The Metro. I'm Robin Vincent.
And I'm Tia Graham. Today on the program, it's no secret many Arab Americans have planted roots in Metro Detroit, but some of the history that enriched this area's vibrant Arab community is untold.
And many Black Detroiters have faced injustice, harm, and generational trauma from the city. The Reparations Task Force has been studying that, but there are concerns about its future.
Plus, boys have been falling behind in school, and their graduation rates have been on the decline. Why is that, and what can be done about it? But first, last week was a time of memorial in the U.S. It was Black Maternal Health Week. And that's notable because Black women are 3 times more likely to die from a pregnancy-related cause than white women. This country spends more on healthcare costs than any other rich nation, but maternal death rates remain alarmingly high. To honor those women, leaders of the Congressional Mamas Caucus put up portraits of Black mothers who died from maternal health-related causes outside the offices of over 50 congressional members. To discuss those portraits and the issue of Black maternal deaths, we have the chair of the Congressional Mamas Caucus here, Representative Rashida Tlaib. Congresswoman Tlaib represents the 12th District, which includes Detroit and Dearborn. Congresswoman Tlaib, thanks for joining us on the Metro.
Thank you for having me.
Of course. So what inspired the In Her Honor project?
I think for so many years, I was fighting when I was a state representative, and now to move with the urgency that is needed when it comes to the Black maternal health crisis in our country. And Michigan has one of the highest Black maternal death rates in the nation. And we know that Black women are 3 times more likely to die from, maternal complications, pregnancy-related causes than their white counterparts. And so for us, many of us in the Mamas Caucus, the Congressional Mamas Caucus that I founded, along with Mothering Justice, that is a national organization housed in Michigan that we've been working together to try to move the institution of Congress on these various issues. And we wanted to put a human face to it. Having these portraits, people are pausing, wondering, what is that outside of many of my colleagues' offices? And when they stop, they see that it's the tribute. The beautiful IRA Foundation is holding this project in her honor to uplift the names and legacy of Black mothers we've lost to a system that continues to fail them. And so people are pausing, understanding, putting that human face. And if you see them, they're also young. I mean, the images is striking of just how young they were.
And Congresswoman, I am also from the Warrendale community, and I want to know about your experience as well, just going through the neighborhoods and the community. What were some of the things that you saw on the ground in terms of Black maternal health and the things that were not happening within the community? Yeah,
I want to be clear, sometimes it's very striking when I say this to people, but I feel like it's needed. Black women are not less capable of giving birth. It's because the systems and institutions have failed to provide many of my Black neighbors in Warrendale and many throughout my community with, comprehensive, high-quality health care that they deserve. But that is not thinking that they're lying. And this is really true for many of the people that have testified, many people that have briefed many of my colleagues and us, that we know there's these racial biases in medicine, that it's an institution that wasn't built for Black women. And it's a broken healthcare system, rooted in injustice. But one of the things that we hear over and over again by the mothers of the daughters they lost to maternal complications, or the husband or the father that now is raising a child on its own, or now without a mother or a child, continues to say they don't feel believed in the system when they say they're in pain, or they're saying there's something's wrong, many of which will tell you that all of it was preventable if they were believed. And so for many Black women, they don't feel safe or supported by the healthcare professionals, especially during decisions of having children or in those moments. And so, again, we know that it is a system that's systemically racist. We have to understand that and truly believe what In Our Honor is trying to tell us in these portrait installations. Amari Monard, whose partner, Shamini Gibson, she died giving birth in 2019. and he wanted to do something because in that moment, I think there's a sense of dehumanization. It's like another Black mother, and he didn't want that to continue to happen.
Congresswoman Tlaib, I'm sorry to cut you off here, but I do want to get to a clip of Omari speaking so we can give the audience a reference of what you're talking about. So here's Omari discussing that right now.
Shamani immediately started complaining about having chest pains, having shortness of breath. We called the doctors, and basically the answer that we got was that she just needed to rest. Both times we told them about her signs and symptoms, and still we weren't heard. The EMTs came, and then the first question they asked us was, is Shamani on any drugs? Has she been doing any drugs? And, we're telling them, like, look, she just had a child. She's perfectly healthy. She's a 30-year-old woman, just had a C-section, and we think that she's having a pulmonary embolism. Fire department came, asked us the same exact questions. Is she on any drugs? The specialist came, asked us the same question, was she on any drugs? And this proceeded to go on for about 15 to 20 minutes before they took her out the house.
So that was Omari Gibson speaking about his wife, Shamani Gibson, who died after giving birth in 2019. He was discussing that she had a good pregnancy, but had health complications. And Shamani did code about 6 times before eventually dying at the hospital. And the thing that would strike most folks who don't understand what's going on with the Black maternal health and death rate here in Metro Detroit, not just Metro Detroit, but the country, it was shrugged off in Shamani's problems. And then people asked rushing Shamani to the hospital if she was on drugs and so many other things that were happening there. Do you think that this is why so many Black maternal deaths continue to happen, that doctors and physicians don't do a good enough job of taking Black women's pain seriously?
Absolutely. I mean, despite having access to care, support, and resources, Shamani's voice, like many voices of so many Black women, were dismissed in very moments that they needed to be heard the most. She should be alive today if they believed her.
And there are other elements to all of this as well. Just last week, we had Dr. Mona Hanna on the show. She's a pediatrician who helped expose the Flint water crisis. She spoke about her program that gives unrestricted cash to pregnant women, and that program was recently expanded into Wayne County. Here is Dr. Mona discussing the importance of alleviating poverty.
For so long as a pediatrician, I have wished the ability to go into my doctor's bag and prescribe away an antidote to poverty. Poverty is a pathogen. It makes kids sick, and it impacts, once again, their entire life course trajectory. So it's something I have wished for. Healthcare, the way it is right now, is a sickness-based system. We spend a lot of money after the fact, but we don't spend as much on preventing things like poverty, making sure that we have clean air and clean water and the infrastructure, the societal infrastructure to make sure that our kids are growing up healthy.
Systemic racism and denying people pain they express is one factor that we've already discussed. How much do you think poverty is also contributing to maternal health-related deaths and complications, especially as we talk about the Warrendale community, that Deep West Side community that you represent?
I mean, it is absolutely always going to play a role, but we still know that many white women live in poverty and are not having the kind of rates that we see in complication in maternal health. They're not dying giving birth at the rates that Black women are. So we know that hospitals, health systems, elected officials must answer to the harm caused here of the fact that there is a system in place that is racist, poor or not poor. You should know, one of the most powerful testimonies we heard was a father, a husband, who lost his wife, and they were not in that poverty, what you would say. They actually were probably higher income. Based on their professional background, it was very clear to me what he kept saying was, we had access, we had health insurance, we had, the resources in place, everything. But at the end, it was the same story as Shamani's. She said she was in pain and they didn't believe her. So it has to be not just around the policy of course, eradicating poverty, which poverty to me has to be eradicated, especially among children, because it creates trauma. But I can tell you that one of the things that I've learned in the last 6 years in Congress and then the 6 years in the State House, that the stories are similar in that we are not listening to Black mothers who are telling us directly that they don't get the same care that other women do when they get into the system, hospitals and so forth. You can hear Black women scared of even having, giving birth now because they hear of the horror stories. And that's why, Birth Detroit and so many others are coming together and saying, look, we're going to provide the care ourselves. We want Medicaid to cover it. We want a policy where we can have doulas. We can have alternatives to being in a system that just wasn't built for Black mothers and Black women. And so I think we need, of course, accountability. We need all of those things to happen. And to me, it's not just poverty. It's also acknowledging systemic racism within our healthcare system.
And Congresswoman, in 2023, I want to continue on to talk about poverty here. You reintroduced the End Child Poverty Act to cut child poverty by 2/3, and that would have replaced the child tax credit and the earned income tax credit with the universal child benefit to provide a payment of $428 per child per month to families. Can you talk a little bit about that legislation and how you would plan to pay for that?
Yeah, well, we'll reverse all the Trump tax plans they put in place where, people, Amazon and all these other corporations don't pay any taxes, although my residents are paying at a higher rate than they are. We can do that by investing in our people, in our communities, and not, the billionaire class. I mean, if you look at just how incredibly unfair our tax system is, you talk about the fact that we'll fund bombs and the, defense war machine, but we won't fund ending homelessness, ending poverty among children, all of that. Because at the end, and I'm not trying to talk about the economy, in twofolds, we end up paying for the cost of that, of not addressing these crises of the fact that we have a chronic problem with poverty in our country. I wish we would have a war on poverty. I wish we would take it seriously in that it is creating trauma, it is creating disparities, but also our children don't deserve, again, for us to turn our backs on them and saying, oh, we can't afford to take care of you, but we seem to always be able to take care of those billionaire class and all those other folks. And again, these are corporations that can't afford it, because I remind people, if you work in the Amazon fulfillment center, probably a majority of those that work there are on food assistance because they don't pay them, a living wage and what they can, what they deserve to be able to take care of their family. But when it comes to ending poverty in our country, I call it, it's like earned income tax credit was the most beautiful, successful, bipartisan effort that did alleviate people out of poverty. It was like that savings account at the end of the year that was there to help families. They used it to fix their car. They used it to pay some of their back bills of electricity and their gas bill, their light bill, their water bill that continues to go up. These are vital things. I tell people the fact that we have families that can't afford their water bills is a travesty in a country that is the wealthiest in the world. But we have to get to some of these root causes of the fact that we have systems in place that keep people in poverty. In the cycle of poverty. My seniors are in a cycle of poverty, even though they work their butts off their whole lives. They now have auto insurance that goes up almost 40% every year. Again, keeping folks in the cycle of poverty because corporate greed is real, and there's always going to be a class of our families and residents that won't be able to access the jobs that you think that they can access immediately. It's not true. And so we have to understand the systems that are in place in our country and why we have to address it with aggressiveness that it deserves. The end poverty, child poverty would alleviate 60%. I mean, we can change lives immediately. We can help our children. And these are the same, colleagues of mine that say to me, we need to be able to give life to children. Well, they're living now, and we turn our backs on them when they're born. And I feel like if you really cared about life, you take care of them throughout their years.
We're talking with Democratic Congresswoman Rashida Tlaib, who represents a lot of Oakland and Wayne County residents, including folks in Detroit and Dearborn. And we're discussing a project the Congresswoman took up to honor Black women who have died of maternal health-related causes. Now, Congresswoman Tlaib, I do want to take this conversation to a different topic here. I do want to talk to you about a few political things that are going on. President Donald Trump has wavered a lot with his tariffs, but much of them are in effect right now. So what are your thoughts on the tariffs?
I mean, understanding that tariffs is very politically charged. I didn't vote for the NAFTA 2.0 for a reason, because it didn't have worker protections. And I understand that some of this, were used as tools to try to make, build more jobs and so forth. But guess what? We, at the end, ended up seeing many, many auto jobs, especially leaving our country. However, the way the Trump administration is doing a lot of things, it's very reckless, kind of cruel. I mean, small businesses are going to be directly impacted by this. The fact that we don't have, the setups right now to even be able to address the fact that, you got all these other countries that are going to go somewhere else. So it is important to understand this, the way that the Trump administration is doing it is very much resulting in this kind of recklessness that is harming people and seeing the cost go up. Now, understand, and I want everyone that's listening, some of this rising in cost, some of it is greed and profit-driven and has nothing to do with tariffs. So we have to be cautious that price gouging is going to happen as soon as announcements happen, so be cautious about that. But again, if we really want to address what is happening in our country and know that some of the largest corporations, the biggest corporations, they're the biggest funders for Trump administration. They seem to have a hold and be able to push back on tariffs for themselves. But it seems like when it comes to actual food at the table, things that impact our residents directly, they want to be reckless and cruel about it. And that's where I have to draw the line and say, we got to make sure the American people are not harmed more.
And in terms of the power of the president, that has been a very big topic recently, especially in the Kilmar Abrego Garcia case. That's where a migrant from El Salvador who's been living in Maryland for 15 years was deported. The Trump administration said it was a clinical error, but after the U.S. Supreme Court said the Trump administration needs to facilitate the return home of Abrego Garcia from an El Salvadorian prison, the Trump administration said they couldn't do that. So how concerned are you about the Trump administration violating a court order and throwing us into a constitutional crisis?
I want everyone to see this more than a court order. The lawlessness is there, absolutely. I mean, over 90% of everything he's doing, he's going around Congress, which is a violation. It's a constitutional crisis that he's creating. However, know that when Mr. Garcia, Mahmoud Khalil, Rasmia, all these people, I know these names are coming up and people are kind of looking away, but know that their due process, their constitutional rights being violated, those are our rights. When they start chipping at the due process of Mr. Garcia and his family, Mahmoud and his wife and family, when you see that happen, you say, well, that's not, they're not American citizens. That doesn't concern me. This is how it starts. Our rights and constitutional rights is the same rights and due process rights that Mr. Garcia, Mahmoud Khalil, and so many others are relying on. And so when they chip at that, don't be surprised. And we're already seeing and hearing U.S. citizens are now being targeted when they come into port of entries, getting their phones taken away, going through their information. That when we start chipping away due process and constitutional rights, it is our rights that the president and his minions are targeting right now.
And Congresswoman, a number of Democrats are wandering around the wilderness right now trying to find their footing and to win back ground that was lost to President Donald Trump and Republicans. Why do you think Trump won in November? And what do Democrats need to be doing right now to win back working class voters who flock to the Republican Party?
I mean, I've seen the numbers in that they say 10 million fewer people came out to vote in the last cycle. That was our Democratic base. Those are the people that wanted us to see us increase minimum wage, to pass something to fix our, healthcare system. And we have sick care in our country. Every town hall, no question, somebody comes up and says, I can't afford my prescription drugs, and they're in their 70s. So, there are folks that are, especially young people, that are saying, we're tired of you all investing in, bombs and destruction and war when we can't even afford our education, or we don't have clean drinking water in our backyard. But we seem to prioritize, again, defense contractors, many of which my colleagues own, stocks in. That's why I have the bill that says you shouldn't be owning stocks and you shouldn't be owning more manufacturing stocks while you sit there and press a button that makes you money. So I think it's important to know, for me, I have been on the forefront and very unapologetic in trying to hold the Democratic Party accountable. The party that my dad and I grew up watching my dad feel a sense of human dignity because they were so pro-labor, pro-union, pro-healthcare, pro-everything. And that's great to say it, but the actions have not matched up. The urgency that we needed to be moving doesn't match up. I heard the most impactful thing, and it hasn't left me, a woman that has been fighting for Voting Rights Act for years said this to me in my office. She said, Democrats are really good about keeping power but not using power. So I hope if we get the gavel back at any level, or we get that power back, that we actually use it to do good in a way that's more urgent instead of constantly pausing and thinking about what does the polling say. I'm telling you right now, the best polling was the fact that 10 million less people came out to vote last cycle because we weren't saying something to them that motivated them to come out and vote for us.
My last question for you, Congresswoman. Israel's war campaign continues against Hamas. Over 50,000 people have been killed in Gaza, and the World Health Organization has reported more than 720 attacks on health facilities from Israeli army in the West Bank since October of 2023. President Donald Trump has met with Israeli Prime Minister Benjamin Netanyahu, and he hasn't done much to pressure Israel to stop the bombardment. You're the only Palestinian American in Congress. How are you reacting to all of this that's happening, and what should American foreign policy look like for Israel and for Palestinians right now?
Yeah, and I want to, I think it's important to know that the support and the unconditional support and kind of, let Netanyahu commit war crimes, let the genocide continue to be funded by our tax dollars, that is bipartisan. There's overwhelming Republican and Democratic support for this. I watched while Netanyahu gave the speech where he attacked Americans exercising their First Amendment right outside of that Capitol, and people clapped for him as he bashed our constitutional rights. As we watched the Israeli government hand over names of students, connected to organizations that support the continuation of ethnic cleansing of Palestinians, handing over names, the kind of collaboration that is happening and saying arrest them, deport them, attacking people like myself and others who are exercising our First Amendment right and saying we do not want our country funding war crimes, funding a war on children and, ethnic cleansing of a whole people. One thing that I know is true, though. The American people are now seeing the truth and the facts in regards to what is happening here. And they want an arms embargo. They want what, Senator Bernie Sanders and 15 other senators supported, is that we need to push back and say no more arms sales until we have a ceasefire in place that is real, not fake, real. And it's being followed through by all parties. But right now what we see is unconditional, hands out, turn the other way while we continue to watch, even on the end of Ramadan and in Easter just recently, attack on Palestinian people. The only crime they ever did was be born Palestinian. And we are, as a country, I cannot believe we're standing by and allowing it to happen. And for them to use racist tropes against the Palestinian people to justify the overwhelming killing of children, targeting of hospitals, tent, refugee camps, and so much more. You can see it happening. It is the reality of it. And every doctor that comes back says all he sees is children coming in with bullets in their heads, being literally assassinated every single day.
Congresswoman Tlaib represents the 12th District. She just spearheaded the In Her Honor project, which honored dozens of Black mothers who died from maternal health-related causes by placing their portraits outside of congressional members' offices. Congresswoman Tlaib, thank you so much for joining us on the Metro.
Thank you.
Coming up next, it's no secret many Arab Americans have planted roots in Metro Detroit, but some of the history that enriched the Arab community is untold. We'll trace some of those stories next. We'll be right back on the Metro. Stay right there.